I am Kimberly Tissot, and this is CMA Meets Able, South Carolina. I am Kimberly Tissot. I am the president and CEO of Able, South Carolina. Yes, so we are a disability-led organization that equips people with disabilities to live as independently as possible, but most importantly, to make their own decisions. We also educate the community to remove barriers, to make it more accessible and inclusive for people with disabilities, and we also provide advocacy. We've been very successful with legislative advocacy, but also working with state agencies to make systems change. Yeah, so Able South Carolina is run and operated by the majority of people with disabilities. So we have 60 staff members, and over 85% of our staff are people living with disabilities. So we are very familiar with the barriers that the disability community faces in South Carolina. We are a rather larger nonprofit. We are divided within advocacy, independent living skills, informational referral, peer mentoring, systems change advocacy, public health, and community access. And we also have a PR division. I think the most vital part of our organization is really elevating the voices of people with disabilities. Disability is one of the largest minority groups in America, and we intersect with everyone. And so we've got to be very mindful of the various levels of discrimination that can happen within multi-marginalized communities. And I think that has been one of our greatest impacts, is really elevating the voices to make change. I don't think our work ever ends. As a leader with a disability, I am always learning some of the barriers that continue to impact the disability community. Our phone rings all of the time with emergency situations, but really how people don't have access to the services and programs that they should. And so while we operate 9 to 5, Monday through Friday, we operate a lot of after hours during emergency situations. So emergency disasters, we are on the ground making sure that people with disabilities are being evacuated properly, but also being included in any shelters. We're advocacy. Disability does not end at 5 o'clock, and so some of our advocacy efforts are after hours and on the weekend. And we are just that safe organization for people with disabilities to feel heard, to feel understood, and to know that they are not alone. So we have so many projects that we do so much within the organization to really make a difference, either in the systems or on the individual level. I think we were all impacted by COVID-19, and a lot of people did not know that our population, people with disabilities, was the population that was dying and being hospitalized at an increasing rate. In fact, COVID-19 is still the #1 cause of death for people with intellectual disabilities in America. So we have created a number of initiatives, but one of the initiatives that I'm most proud about is an initiative that was really focusing on multi-marginalized people with disabilities. So going into the Black communities, working with people with disabilities in those communities to learn their barriers, the never-ending barriers to get vaccinated or to get health care even. And so we really learned from our community to be able to make an impact. And we've been able to get hundreds of people who are multi-marginalized vaccinated, learning their risks, and then also educating the communities to be more accepting of disabilities. Every culture sees disability differently, and we have to understand that as well. But we also have to understand that people aren't just being discriminated based on disability, but they're being discriminated based on race, socioeconomic status, education, you name it. And so we've got to really count. We have to include all of those barriers in the education that we provide to be able to uplift a community to make sure that they're served. So other agencies for people with disabilities are often run by people without disabilities, which really creates that disconnect. Able South Carolina is disability-led. We understand the people that we serve, we understand the barriers that they face, and we understand solutions, and we're never going to give up on them because we know what they are capable of doing. And that's really what puts us apart, is that disability-led piece. We are a team of professionals. We've got people with master levels, we've got people who graduated from Harvard, we've got strong disabled people on our staff who is willing to get their hands dirty, go out in the field, to be able to serve all of the disability community. And when I say all of the disability community, we serve people with psychiatric disabilities, intellectual, developmental, vision, hearing, physical, and we also serve all ages. So there's no disability that we do not serve. So people who are ethnic minorities with disabilities, they're not looked at as a whole. And so when consumers come and receive services from us, we do look at all of the marginalizations to make sure that they are not only feeling accepted, but they have all of the tools that they can to navigate the community. Over 55% of the consumers that we serve are people who are ethnic minorities with disabilities. And so we're very connected with different organizations, but we're also very connected within the multi-marginalized community so that we can provide a bigger impact. So Able South Carolina has a number of initiatives. What some of our initiatives are, we really want to break down the barriers that South Carolinians are facing. South Carolina has one of the lowest graduation rates for people with disabilities. We're number 2 in the country for having the lowest graduation rate, so there's a lot of work around that. We have the 7th highest unemployment rate for people with disabilities in South Carolina, so we have initiatives around education and employment, along with other barriers that truly impact our community, which is transportation. But the number 1 barrier in South Carolina is stigma. And so we're wanting to really provide a lot of education to inform people that disability is all around us. 1 in 3 people in South Carolina have some type of disability. So we are not a small community. We are everywhere. We are your neighbors. We are your teachers. We are your family members, your husbands and wives and children. And we really deserve to feel comfortable and feel like a true citizen in South Carolina. Yeah, so anyone can call Able South Carolina. So we serve people with disabilities, but we also will provide information referral services to people without disabilities to help you navigate the system. We can also provide education to make your employment offices more accessible and inclusive. We can make your businesses more inclusive and accessible. We can look at websites to make sure that they are fully accessible, so we can truly not only serve disabled people, but we can also serve non-disabled people with truly building that equity for people with disabilities. So equity for people with disabilities really means leveling out the playing field. We're looking at accommodations, we're looking at modifications that will allow someone with a disability to participate along their peers without disabilities. And so equity is critical for everyone to push forward in South Carolina because one size does not fit all, and we really have to look at individuals' needs and access areas. I'm Kimberly from Able South Carolina. Thank you for watching CMA Meets.